Good afternoon, everyone. I'm so happy to have you here today, and I'm so happy to talk to you about poisoning prevention. It is a much bigger problem than you might think. In fact, poisoning is one of the leading injuries that sends people to the hospital, and more people die from poisoning than from car accidents. That is a true and sobering fact. So I am Kristen Wenger, and I am the education coordinator for the Blue Ridge Poison Center. All right. Most people are not really sure exactly what a poison center is or what we do. So in case that describes you, let me give you a very quick explanation. Poison centers are staffed by nurses and doctors with additional specialized training in recognizing and treating exposures to poisons of all kinds. In other words, we are the poison experts, but we're not a clinic that you visit. You call us on the phone for information and advice. And last year, the Blue Ridge Poison Center handled nearly 29,000 phone calls. By the way, there are 3 poison centers in Virginia. And if you look at that map there, my center is in Charlottesville, but we cover all of those counties shaded in blue, which I think is probably most of you on the call today. And there are 50 poison centers in the whole country. But here's the good news. You don't need to worry about what poison center is assigned to you. We all share the same toll-free number. So it's kind of like 911. Doesn't matter where you are, you just dial that number and it will automatically go to the poison center that is caring for you. All right, I'm going to start with a really quick story about something that really happened to one of our callers. Imagine if this happened to you. What would you do? So somebody called us. They were watching their nephew. And their nephew was a toddler, and he was happily playing, and they had just finished taking a bath, and her phone rang, and it was in the next room. So she had to leave the child alone for just a minute to go get her cell phone and answer the call. A couple of minutes later, she came back into the room and discovered that her nephew had found a bottle of pills. She wasn't even sure where he got them from, and he had somehow ripped that cap off. And I know we all tend to think that those caps are childproof, but they're not. There's no such thing as childproof. So he somehow got that cap off, and all the pills are spilled on the floor around him. And she rushes over and opens his mouth, doesn't see any in his mouth, but he has a couple in his hand. So naturally, she was really upset, as anybody would be in this situation. So what would you do if that happened to you? You might call 911, and that would be a fine thing to do, except when you call 911, the person who answers the phone is the dispatch operator, and they can't really help you with a medical question. They can send the rescue squad or the fire department or the police to your location, but that might take a while for them to get there. You could also try to call the doctor, and that would be a fine thing to do, except it's not always easy to get your doctor on the phone immediately. You may have to leave a message, and this is not a situation where you want to leave a message. So what this caller did was call the poison center, and that was a perfect thing to do. The poison center nurse was able to help the caller figure out the maximum number of pills that the kid could have swallowed based on how many were in the bottle, how many might be missing, and what the medicine was. And the caller was helped immediately, and the nurse was able to determine that even in the worst case scenario, this child was not in danger. There wasn't any reason to rush to the hospital. So I hope that gives you a great idea of how the Poison Center can help you. And also, the rest of our talk today is going to be about adults, and in particular senior adults, but this is just a shameless little plug for my 6 o'clock talk today, which is going to be all about preventing childhood poisoning. So before I go much further, let me define what I mean by poison. What is a poison? Well, a poison can be any substance that harms you if it gets into your body in the wrong way or the wrong amount. And let me explain what I mean. Hand sanitizer, something that we are all very familiar with these days. Hand sanitizer, when you use it according to the directions, is safe. You squirt a little bit on your hands and you rub it around on the skin of your hands, and that is completely safe to do. And it's a very important germ fighting tool. However, if you swallowed hand sanitizer, that could be poisonous. Hand sanitizer contains alcohol and other ingredients too, but in particular alcohol. And so that would be something getting into your body in the wrong way. When I say the wrong amount, alcohol is a perfect example because many adults can safely enjoy moderate amounts of alcohol under the right conditions, but we all know there is an amount of alcohol that can be quite serious to swallow, can be quite deadly. So almost anything can be poisonous if it gets in your body in the wrong way or the wrong amount. What are the most common sources of poisoning? Well, they tend to be things that we find right in all of our homes, including cleaning products, pesticides, automotive products like gasoline or antifreeze, personal care products like mouthwash or hair care products, alcohol, of course. But the number one source of poisoning for everybody at every age from birth to age 100 is medicine. Now, medicine isn't bad inherently. When used correctly, according to the directions, medicines can help us feel better when we're sick and they help our bodies fight disease. But just like household chemicals, alcohol, pesticides, etc., medicines can be poisonous if used in the wrong way or the wrong amount. Medicine can come in a lot of different forms. It can be a patch, a spray that we inhale. It can be something you inject with a needle, a liquid, a cream, or a drop that you put in your eyes or your ears. So we tend to think about medicine as just being pills, but take a minute and think about all the things in your home that are medicines but are not pills. And medicines also come in many types. We tend to think prescriptions when we think about medicine, and prescription medicines, they are a big reason for poisoning. And we're going to talk about prescription medicine safety in particular in just a minute. But over-the-counter products are also medicine, like pain relievers, cough and cold and flu preparations, sleep aids, also vitamins, and even herbal supplements. So now that you know about all the different types of things that are considered a medicine and all of the different forms that it can come in, just think for a minute about how many medicines you take on a regular basis. Believe it or not, most adults that are age 65 and older regularly take at least 5 different medicines every day, and even more on an off and on basis. Of course, the more medicines you take and the more you have in your home, the greater the chance of making a mistake. So how can medicine be poisonous? Let's talk about some examples. You can take medicine in the wrong amount. You can take the wrong thing. You can take medicine the wrong way. And you can take medicine in the wrong combination. I have some examples of each of those kinds of scenarios. This is something that the nurses at the Poison Center hear on a routine basis. I forgot that I already took my medicines this morning. This is called double dosing, and it's surprisingly common. In fact, it's the number one medicine mistake reported to poison centers every year. Last year in the entire country, there were over 84,000 cases of accidental double dosing reported to poison centers. So it goes like this. You wake up in the morning, or maybe you finish your breakfast, and then you take your routine prescriptions. And then something happens that distracts you. Or maybe you're in a different environment. Maybe you're on vacation or at a family member's house, or maybe you have guests in your home, or maybe the phone rings. It could be all kinds of things that happen that interrupt your regular routine, and everything feels a little off or a little different, and you just get distracted and you accidentally, out of habit, take the same medicine again. So to help prevent this, some people like to keep a list, like a checklist on the refrigerator, or you can download apps onto your phone that help you keep track of whether or not you've taken your medicine. Some people like to keep a little booklet next to the bed or in the bathroom. They can just check it off. But keep in mind that the most common reason why this happens is because something about your daily routine is different. So when you're on vacation or if there are guests in your home, that's a time to pay extra special attention to what's happening around you. Now, of course, sometimes people take too much medicine on purpose because they think that twice the product is going to give twice the results. But that is not true. More is not better, and it can cause harm. I want to talk just for a second about herbals and herbal supplements. And many people take these, and I'm not going to knock that at all. It's a some people really swear by a lot of the herbal supplements that they take, and some people like to make their own herbal supplements, and many people find them to be very helpful. However, keep in mind that just because something is natural does not automatically mean that it's safe. So herbals and other substances found in nature, they still contain chemical compounds which could be harmful if used in the wrong way or the wrong amount. Now, this really sad news story is a true article about a college student who died after drinking homemade poppy seed tea. Some people think that poppy seeds can help manage withdrawal symptoms if you have an addiction to opioids. And by the way, that is not true. They do not help. If you eat poppy seeds in a normal amount, like in a poppy seed muffin, you're going to be just fine. That is not a harmful amount. However, if you steep a whole bunch of them in hot water to make a tea, that is going to concentrate the chemical compounds into a dangerous amount. So remember, just because something is natural doesn't mean that it's completely safe. Here's another thing that our nurses hear often. I just took my wife's medicine by mistake, or my husband's medicine, or the dog's heartworm pill. That's a common one. So taking somebody else's medicine is the second most common mistake reported to poison centers. And last year, there were 46,000 of these cases handled by poison centers in the country. So a great way to prevent this accident is, first of all, if there are multiple people in your house who take medicine, try to have their medicines kept in a separate place so you don't accidentally grab the wrong bottle. Also, make sure that bottles of medicine are clearly labeled with someone's name. And if you and another person in the same home use a pill minder, make sure you put your name on the pill minder in really big letters, and maybe even have different pill minders that are completely different colors or different shapes so that it's a lot trickier to grab one by mistake. I was confused about the directions. Oh, we hear this a lot as well. And this is a common example. There are many examples, but this is a common one. So Spiriva, and I'm not knocking Spiriva, it just happens to be a common product that this problem happens to. Spiriva is a medicine that you take by putting a capsule into that device and then inhaling an aerosol that is created from the capsule. But sometimes people misunderstand and they swallow the capsule because it looks like a pill. It even comes in a little blister pack like a pill. So when you are prescribed a new medicine or if you buy a new over-the-counter product, make sure that you spend some time with the label and be confident that you understand how this medicine is supposed to be taken. And if you have any questions, don't guess. Call your doctor, ask to speak to the pharmacist, or you can call the poison center and we'll be happy to help you as well. I didn't know I wasn't supposed to combine them. A lot of medicines should not be combined together or with other products like alcohol, for example. And there are even some medicines that you shouldn't take with certain herbal products. For instance, if you are taking an antidepressant, it's considered dangerous to also take St. John's wort, which is an herbal supplement that some people take for depression. So if you combine those two things together, that could be bad. How can you avoid this mistake? Well, it's pretty simple. Keep a list of all the medicines that you take. Keep it with you so that you can show it to all of your healthcare providers and also the pharmacist if you want, so they can help you avoid side effects from bad combinations. Now, at the end of the presentation today, I'm going to be sending personal poisoning prevention kits out to everybody who registered, who asked for one. And I'm including in all of the kits a personal medicine tracker that I developed here at the Poison Center so that you can have one. If you like it, you can use mine. But if you don't like mine, find a method that works for you. There are also apps you can download on your phone. Doesn't really matter how you do it, just make sure you have a way to keep all the medicines you take with you at all time, and don't forget to include any supplements, vitamins, and even over-the-counter products that you take from time to time. A quick note about prescription medicines. Some people think that if a doctor prescribed them, they must be safe, right? Because my doctor wouldn't prescribe something for me if it was harmful. Well, the reason that you need a prescription for certain drugs is because if they're taken in the wrong way or by the wrong person or in the wrong amount, they could be quite harmful. And your doctor has carefully weighed all of the factors, including your medical history, perhaps how much you weigh, what other medicines you're taking, how you react to certain medicines that you've taken in the past, any allergies that you might have. Your doctor has carefully weighed all of those factors before prescribing something to you. So if someone else were to take your medicine without a doctor's guidance, they might have a harmful reaction. So sharing pills is a common practice that lots of people do, and it's a really dangerous thing to do. So don't take anybody else's prescription medicine, and don't let others take your prescription medicine. Let's talk about over-the-counter medicines. So how do you know if you're taking an over-the-counter medicine safely? A doctor doesn't have to tell you how to do it. So how can you be sure that you're doing it the right way? Well, by law, every over-the-counter product has to have a label, and it's called the drug facts label. And that label has to be on the medicine container or on the box that it comes in, or sometimes it's on a little piece of paper that's wadded up and included inside. And this drug facts label has everything that you need to know about taking the medicine safely on it. And it's a very sobering statistic that 1 out of every 2 adults does not really know how to read a drug facts label accurately. So we're going to spend a little bit of time on that because maybe this is you. So what does the drug facts label tell you? Well, by law, it must contain all of this information. It has to tell you the active ingredients. So the active ingredients are the chemical names of the actual medicine in the product. And it also tells you what it's used for. Be careful, because if you take more than one over-the-counter product that has the same active ingredients in it, you could be accidentally overdosing on that active ingredient. The drug facts label also has to tell you the uses, in other words, the symptoms that the medicine treats. It has to tell you any warnings, such as side effects or other medicines that should not be taken with this medicine. It has to share the directions, in other words, how much you take and how often you can take it, and anything else you know about safely taking that medicine. And lastly, it contains other information that might be relevant to that particular drug, and it also has a list of inactive ingredients. And some of the inactive ingredients might be things that people have allergies to. All right, this is a very scary looking slide with a lot of words on it, I realize. But take just a minute and look with me at all of the different things on the drug facts label, so that the next time you're reading one on your own, it won't seem quite so busy and scary. So number 1, see the number 1 up at the top there? Let me see if I can use my pen. I think I can use this. There we go. All right, up here, number 1. This is telling you that it's the drug facts label, and right beneath it, it's telling you that the active ingredient in each of the caplets is acetaminophen. Acetaminophen is a pain reliever, and it's commonly sold under the brand name Tylenol, but there are many other brand names as well. But acetaminophen is the chemical name of that ingredient. Number two, here are the uses for this. So this is going to temporarily relieve minor aches and pains due to all of those things there: headache, backache, toothache, whatever. So if you have an upset stomach, this is not the medicine for you. This isn't going to do any good for your upset stomach. So you would want to avoid this medicine and find one that has an active ingredient to help your symptoms. Let's look at number three. There are a lot of warnings with acetaminophen. So even though you don't need a doctor's prescription to use it, doesn't mean it's completely safe. So you can have severe liver damage if you take more than 4,000 milligrams in 24 hours. If you combine it with alcohol, there's other things here that it tells you. There are possibly some severe side effects, including skin reddening, blisters, and rash. If you have any of those side effects, you have to stop using it and seek medical care. So it would be really important to know this ahead of time before you take acetaminophen, so that if you develop a rash, you will instantly know, oh, this is one of those side effects they warned about. I'm supposed to call my doctor. Let's look over here at number 4. Here are the directions. And what I want to point out is, and this is pretty common for over-the-counter products, the directions might be different for children. So in this case, children under age 12, you should ask their pediatrician before you give them this medicine, because it might not be safe for them. And if you're an adult or 12 years and older, so an adult or a teenager, it tells you the maximum amount that you can take so that you don't accidentally overdose on the active ingredient, acetaminophen. And then down here, we've got some other information. It's important not to store it somewhere where it's going to get too hot or too cold. And here are the inactive ingredients in case anybody has an allergy to any of these things. And then there's always a number in case you have questions or comments. You can also call the Poison Center should you have any questions or comments. All right, I'm going to turn off my highlighter now. Okay. All right. Let's talk about safe storage. That's so important in your home. We already mentioned this first one. If there are multiple people in the house taking medicine, as best as you can, keep them separate from each other to avoid anyone accidentally taking the wrong thing. We're going to talk a lot more about this at 6 o'clock today, or if you come back later for the recording of the 6 o'clock presentation. But to protect children, keep all medicines, and for that matter, anything that could be poisonous, up and away, out of sight and out of reach. And lastly, it's really important to protect your prescription from diversion. Now, I'm imagining some of you right now are saying, what's diversion? Well, it's kind of a new concept, but it's really important. So we're going to talk about that. When prescription medicines are gotten or used illegally, that's called drug diversion. So in other words, taking someone else's medicine without their permission or stealing it. Why might this happen? Well, there's 4 main reasons why drug diversion might happen. The first one is recreational. In other words, someone taking a prescription pill because they think that they can get high or have a good time. So there's no medical need. They just want to take this medicine because they think it's going to make them feel good and feel better and have a good time. The second reason why somebody might steal medicine is because they have an addiction, which is a very serious medical condition. And if you or someone you know has an addiction to medicine, there is help that you can get for that. And I hope you will speak to your doctor, because they'll be able to guide you to all kinds of resources to help you or your family member or your loved one with an addiction. But some people, when they have an addiction, before they seek help for it, they might try to get as much medicine as they can so that they can continue to feel the same way. And that's how addiction works. When you're addicted to a medicine, it takes more and more of the same product to achieve the same result. So, whereas you might feel better originally just taking one dose, if you get addicted, you might need a whole bunch of doses. And if you're not careful, then you can actually overdose. And that is a serious problem that it kills a lot of people in our country right now. A third reason why someone might divert drugs is because they're interested in harming themselves. So this is hard for us to think about, but it's a fact that someone who's considering suicide might choose to take a lot of medicine in order to do that. And that might mean they have to go through somebody else's medicine cabinet to find medicine to harm themselves with. And then lastly, someone might steal drugs just because they can sell them. And this actually happened to my mom. This really happened to her. My mother lived alone and she was taking a pain medicine for a slipped disc in her back, which, if you've ever had, is very painful. And she lives alone and there are no young children around. So it never occurred to her that she should, you know, hide her medicine. So she kept it out on the kitchen table. Well, she had her house painted, and the house painters looked through the window while they were outside painting the house, and they saw her medicine on the kitchen table. And when she wasn't in the room, they snuck in and stole it. And she didn't even realize it for like the next day. So it's not something that we like to think about, but unfortunately, since people do sell pills on the black market, we have to start thinking about our medicines as something that we have to protect. And this is new for us. We're not used to thinking about our medicines as something that we have to protect. So why should anybody care? Why should my mom care? She lived alone. Well, first of all, if your medicine is stolen, you have to replace it, and that can be very expensive. But also, you don't want to let your medicines become the source of someone else's harm from an overdose. And also, you don't want your medicines to become the means by which somebody can harm themselves. So how do you stop drug diversion? Well, first of all, just keep track of all the medicines in your home. You should have an idea of how many pills are left in all of your pill bottles, and you should know what they look like so that if someone has replaced them with something different, that will stand out to you. You also might want to use a box that you can lock them up in, and you might want to keep them in a less obvious place. So my mother should not have left those out on the kitchen table, even though she lived alone. And then lastly, you want to get rid of any medicines that you have that you don't need anymore, because if they're not in your house, then nobody can take them. And I know that Brianne wants to talk to you about a couple of things related to this slide. Brianne, do you have some things to add about this?
Absolutely. So we definitely encourage individuals or families to lock their medications. It's part of our Lock and Talk initiative. And if you are not from the Rockbridge area, just contact your local community services board, because more than likely they are providing the locking medication boxes free of charge. So we want to make sure that you have a way to be able to lock your medications and keep them safe. Also, one of the other resources that we have to provide are these drug deactivation packets. We call them disposal pouches. So you can put up to about 45 pills in this, put a little bit of water in there that has the active ingredients that breaks down the chemicals, seal it, and then throw it away. It is biodegradable. So you can put it right into the trash can at your own home.
All right, we're on the home stretch here. We're almost done. Let me summarize some of the most important things we talked about today. First of all, to prevent a medicine poisoning, read the label on all your medicines every time. This is to make sure that, first of all, you're taking the right thing. You're not taking the dog's pill or a medicine, a different medicine than you think it is, and make sure that you're taking it in the right way. Number two, pay attention to doses. The doses are important. More is not better. So the dose is always listed on your prescription medicine, but if you read the drug facts label on your over-the-counter products, it'll tell you what the safe dose is for those medicines. Number three, Keep a record of everything that you take so that your doctor and your pharmacist can help you avoid bad interactions. And don't forget to include your over the counter products and your supplements. Number 4, store medicines safely to protect others. So keep them up and away, out of the sight and reach of children. And lastly, protect your prescriptions from diversion by making sure you lock them up and you put them in a place that is not obvious, that is known only to you. All right, just a reminder, if anything happens, call the Poison Center and we'll be happy to help you. Don't waste time on the internet. The internet is notoriously wrong. Also, if somebody swallows something that they shouldn't have swallowed or they overdose on any medicine, don't make them vomit. That seems like a no-brainer, like, oh, if something went down into the stomach, then we just make it come back up and that solves the problem, right? Unfortunately, it's not that simple. It doesn't work and it can actually cause more harm depending on what they swallowed. So don't make someone vomit. Call the Poison Center first and don't wait for symptoms because symptoms don't always happen right away. And that doesn't mean that harm isn't happening. Just another quick plug for the Poison Center. Why should you call us? Well, we've already talked about how you can get immediate help from our experts. It's completely free. It's completely private. And we never close. You can call us on Christmas Day. You can call us at 3 o'clock in the morning and a real live human being will answer the phone. Another reason to call us is because much of the time we keep people out of the hospital. So if you haven't really had an exposure that's going to cause harm, we'll be able to let you know that right away so you don't have to rush in. Now, that doesn't mean that sometimes we don't say, oh, you know what? You should go to the hospital. You should go to the ER. We sometimes do say that, but then we will ask you where you're going. Remember, we're covering 54 counties of Virginia, and there's about 22 hospitals in our territory. We have all of them on speed dial, so we can call ahead of time and let them know that you are on the way and offer our advice to the healthcare providers who will be caring for you once you get there. So don't guess. Be sure you're never bothering us. Even if you just have a question, you can call the Poison Center. You're not going to get in trouble if it turns out that there hasn't been an accident. We're not like 911 in that sense. You can call us anytime, it doesn't matter, and we will help you in any way that we can. All right, that's the end of my talk. The Blue Ridge Poison Center helps thousands of Virginians every year. Here's something you can do to help us. You can take a survey. It's a very short, anonymous survey. There's only 5 questions, which will let me know whether or not I did a good job and you learned anything from this talk. So all you have to do is hold your smartphone up to that little funky looking square with your camera open, like you're going to take a picture of it. And it will automatically open up into a link, which I also will send Brianne the link so she can put that in the chat. If you'd rather do this on your computer instead of on your smartphone, I'll put the link in there in just a second. And it's anonymous. You don't have to tell us your name, but it really will help us out. And if you're watching this as a recording instead of live, this will still work. So even if this is weeks later, you can still take the survey. We would really, really appreciate it. All right, I'm going to be sending poison prevention kits to those of you who requested one. You see that website address on that last screen there. If you go to www.brpc.virginia.edu, you can order a kit anytime.